Can you introduce yourself, please?
Yeah, good morning, everybody. My name's Ian Saunders. I work at NICE as a program manager, and I'm the contract manager for the CKS service. Okay.
Fran? Thanks, Ian. I'm Fran Wilkie. I also work at NICE. Part of my role is to help people find and use the resources that NICE makes available. So that's how I've got involved with today.
Lovely. And I'm Emma Soul. I'm a consultant physiotherapist at University Hospitals of Derby and Burton. I'm also a honorary lecturer at Keele University, and I'm a NICE fellow, and hence why I'm here in that latter role. So brilliant. Moving swiftly on then, Ian, would you please introduce to us about the CKS and how they've been developed?
Brilliant. Thank you, Emma. So the Clinical Knowledge Summaries service at NICE are a set of summary topics on 370 or so disease areas or symptoms that are very prevalent in primary care. The purpose of these resources are to give primary care professionals and first contact professionals an overview of the treatment and diagnosis of these conditions. Now, they're not strictly NICE guidance because they aren't created according to a NICE development process or approved by the NICE guidance exec in the same way that NICE clinical guidelines are or technology appraisals. So they don't fall into that category, but they are authored by using a NICE accredited guidance process by a group of by a company called Clarity Informatics that NICE commissions and contracts. So the process that is used, NICE maybe 10 years ago got into this program of accrediting guidance development processes in other organizations like Royal Colleges and so forth, and Clarity Informatics, their guidance process was accredited via that process and has been re-accredited every 4 or 5 years. So although it's not strictly NICE guidance in the same way that clinical guidelines are, it's it's created using a robust process, and every 6 or 7 years we procure the service, which goes out to tender and people can bid for it. So the service is an interesting one. It's not NICE guidance, but it follows NICE very, very closely. So the idea is that wherever NICE has a guideline, they will include content on that. What they will do is possibly set it in the context of primary care. So obviously all the guidance, you know, if there's referral guidance, if it's just for primary care, they'll focus on those things. They also have a standard structure that Fran will take you through in detail to each topic. So each topic deals with some background information. It has diagnosis section, a management section, and the management section is broken down into various scenarios. Plus there's information about how the actual topic was created. So there's an evidential aspect to the information on the site. And again, as Fran will show you, within each of the topics or even the sections, there are evidence sections that describe where these recommendations have come from. And in the main, as I say, where there's a NICE guideline, it will be nice recommendations. But it is a bit wider because, as you probably appreciate more than I do, NICE guidance doesn't cover everything that requires treatment. So the clinical knowledge summaries are wider in the sense that for treatments, even where there is NICE guidelines, they deal with the other aspects of care that aren't covered in a particular guideline. But they also cover topics that are very common in primary care for which there is no NICE guideline. So it's a pragmatic service. It's a synthesis of evidence. It will use other high quality resources from organisations like Public Health England, the Royal Colleges, professional societies that have a strong evidence-based guideline development process. So they look wider than just NICE. The structure, when you see it, it will look slightly different to NICE as well, in that the information is quite punchy. It's all bullet points because it's developed with the intention of being used before, during, or after a consultation. So it's not a full referential product, if you like. It's supposed to be a practical product. You can use it as a reference guide, and I know it's popular. I think Emma will talk about the connection is to sort of just self-learning, training, that kind of thing, students. So it can be used in that way, but the intention is that it is a more practical product, and it should be quick to find the topics that you need, quick to find the sections that you need to work on, and quick to kind of actually absorb all it has to say. It's hard to do that in a short consultation period, but that's the intention. And so the other things I was going to mention was that, we have 370 topics, and obviously the evidence base moves. And so we have a 5-year sort of maximum period in which every topic should be reviewed and potentially updated if it needs it. So, there's like a constant churn of maybe about 75 to 80 topics being reviewed every year. It leads to, and they're kind of scheduled reviews. But there's also changes to that kind of 5-year cycle. Say NICE brings out a new guideline, that would trigger an earlier review than the 5-year schedule, or another organization brought out something equally weighty, or there's a major change in drugs or something. There's a safety concern, so that would trigger a sort of earlier review and update. And also there's almost constant mini updates. So as drug licenses change, we try and accommodate that information as soon as possible. If there was anything really, really serious that needed to be dealt with, and I think we've only had one of those in like the 10-year history, we can update it in 2 days basically, and we've done that in the past. That's the kind of limit we have. So there's a constant churn. It's very hard to maintain a completely up-to-date evidence-based resource, and so the date information is quite clear in terms of when we've produced these things. And the last topic, I think, was the new topic. So there is an expansion into this as well. It doesn't stay still. So every year we create between 7 and 5 new topics, and they tend to be based on NICE guidance that's coming out that's relevant to primary care. And so at the start of each year with the provider, we talk about what's coming up. We think about new candidate topics. We also speak to the RCGP on that, because they have a program of work that kind of is useful sometimes. And also we just, sometimes we get just user suggestions for new topics. They have to come with a decent evidence base, but in some cases it doesn't have to be NICE guidance. We have done some things recently on developmental rheumatology, for example, that doesn't have a NICE guideline, but was felt to be sufficiently prevalent in primary care and complicated that it needed some sort of review. And they were able to do the literature searches and synthesize the recommendations and pull in whatever guideline that was available for the various disorders that they kind of talked about, or symptoms. And so we develop it. And it is, the very last thing before I stop wittering on is that it is UK based, UK and Jersey and Guernsey and all the overseas, British overseas territories. So if you're outside of that, if you're working outside of the UK area, then you're able to access the same information, but under subscription to a sort of parallel service that Clarity, the current provider, produces from their own back. So that's called Prodigy. And it's Prodigy, a service from Clarity Informatics. You can find it on the internet, or if anybody's interested, we can put the information in the chat. But I think that's basically all I was going to talk about. So back to you, Emma.
That's lovely. Thanks, Ian, for that. So we move on to Fran now to give us a whistle-stop tour of the CKSs.
Absolutely. I'm just going to share my screen for you so that you should be able to see the NICE website on here. So first of all is how to access CKS. So there is a URL that you can type in and go to, but the easiest place to remember where it is that they're always linked from any page on the NICE website. The NICE website has all of this toolbar that runs along the top, which are links to different information resources that we have, and CKS is sitting here. So that's on the top of every page that you go to. When you click on that, you can access the clinical knowledge summaries in 2 different ways. You can either use the A to Z, or you can go by specialty. If I just show you quickly the A to Z, I'm going to click on S for shoulder pain, and then shoulder pain's here in the middle, so you can see all the different topics beginning with S. Click on shoulder pain and it takes me into here. If I just go back again, and show you the specialties. You can see here we've got a musculoskeletal specialty. If I click on here, I think there are 37 different topics in here that have been grouped together as being relevant as musculoskeletal conditions. And again, I can click into shoulder pain from this listing. So when I click on a topic, I'm taken to this page. This is the landing page. And as Ian said, they're all laid out in exactly the same way. So it makes it much easier to navigate your way around. So this landing page gives a little bit of a summary and a little bit of information about the topic that you've picked up. But the way to move around is using this navigation menu on the left-hand side here. So I'm just going to go through the different sections. So the summary is where we've landed. The have I got the right topic gives you this little bit of information about what it does and doesn't cover. It gives you an idea of the age group that you're looking at, and it gives you links to kind of other topics that might be useful based on the one that you've clicked into. So it's just helping you check that you're in the right place and looking at the right CKS. Going back to the menu, the next option down is how up to date is this topic, and Ian's talked about the update cycle that we have. So this is where you'll find the information about when it was published and when changes and updates were made. And again, it goes through step by step and tells you what was added and where that information came from. The next option on the menu is goals and outcome measures. And this kind of does what it says in the tin, but it includes options for things like local implementation, audit criteria and stuff. So if that's useful information for you in terms of implementing, then that information is all sitting underneath this option. Next, we've got the background information, and some topics have more information on here than others. This topic for shoulder pain just has some information about causes, and if I click on it, then goes down, and you can see everything's done in bullet points to try and make it easy to read and pick up from within there. Some of the other topics have more information on the background info, and I'll show you that in a second. You've then got a diagnosis option on here, and again, if I click into it, it talks about taking a history. It links to the different resources that you might use to do that, so it's all laid out for you. We're getting down to the management section, and the management splits up the information into different scenarios. So you can jump around using the menu to the bit that's most relevant. I'm just going to click on the initial management option here. And this is where you can see it really comes into its own with the bullet points. It's distilling the guidance down into those manageable and easy to follow chunks. And I'm pulling out, as Ian said, the stuff that's really relevant to what you're doing in primary care. Each of the sections in here has this basis for recommendation link. So on the right hand side, it's kind of an extra bit of a menu. And if I click on that, it takes me down to the bottom where it's got the basis for recommendation. And it's showing you where they've got the information from to create those bullet points and put that information with links out to different articles as you need them. So everything's referenced, everything's there, easy to pick up. That brings me on to this supporting evidence tab. So this kind of tells you where the information's come from. And in this instance, it's telling you that the links are referenced throughout the topic. So as you go through the diagnosis and management bits, it's giving you the information about where that supporting evidence has come from. Getting down now to how the topic was developed. So if you want to look into the detail of how each one was put together, you want to see the search strategy that they used, which guidelines they used to pull that information through, you can click through all the different links from within here. So it's meant to be as clear and transparent as possible about how this topic was put together. And then the very last link on this left-hand menu here is the references, and that's where you get a full list, and it will give you links to abstracts where they're available or links to the full text if that's available as well. So as we said, that's just a very quick tour around what an individual CKS topic looks like. I'm just going to use this breadcrumb trail at the top here to take me back to the CKS homepage. And I just wanted to show you, as well as the A to Z and the specialty groupings, you can use the search bar at the top to search for a topic if you find that easier to do. And you'll see as I start typing, it has this little type ahead. So I can just click from here. I don't have to remember how to spell plantar fasciitis. I can't even say it, fasciitis. And from within there, it's taking me. And again, you'll see the same layout. So I can click around into the bits that I want. If I go to the background information, I mentioned on the previous topic that some topics have more information. So there's definition information here, there's causes, there's prevalence, there's prognosis. So all that kind of background stuff. And again, if I just want to go straight through to the management, I can just click using the menu bar here. So that's it in a nutshell. That's how to use them and how to make your way around them. The last thing I wanted to talk to you about was how you can add a link to CKS onto whatever device you're using. So you can install what's called a progressive web app so that you can access CKS easily and quickly. I've got a couple of slides I'm just going to show you. So I'm just gonna, can you see the slides on my screen now? Yeah, I've got a nod, that's brilliant. Okay, so the progressive web app, you're not going to the App Store to download it, but it's a bit of technology that enables you to run CKS in its own little environment on your device. It's not available from all browsers. So like I said, you don't go to the App Store, you're downloading it from the web browser itself. You can do it from Edge and from Chrome, but you can't do it on Safari or on older versions of Internet Explorer. So you can't do the same thing on an iPhone as you can do. I'm going to show you on the laptop, but I can show you how you can add a little icon to your home screen so you can quickly access it on your phones as well. So if you're on your laptop or on your tablet, you open up your web browser, and if it's like Edge or Chrome, when you go to the CKS website, you'll find an extra little button that's in your address bar. So you can see here, this is what it looks like in Edge. It has this little button along at the right-hand side of the address bar that says Install CKS. And this is what it looks like in Chrome. So a slightly different icon, but it's there at the right-hand side of your address bar. Once you've clicked that to install it, you can access it from the Start menu in Windows. So if I'd done this on my laptop, I click on the little window buttons to open the Start menu, and you'll see here it's under C for CKS, although the icon actually says nice, it is listed as CKS. And you can pin that onto your menu so it appears over here, or you can pin it onto your taskbar so it appears down at the bottom here. You just right click and choose the pin options from within there. From a phone or a tablet, once you've installed it, you should just get a little icon that sits alongside your other icons from within there. And again, it says nice in the little icon itself, but underneath it's there as CKS, so it should put it in nicely in alphabetical order for you if that's how you order yours. Once you click on that icon, it opens a kind of new self-contained window. So it looks the same as the website, but it's running in its own little environment. And it works in tandem with a service worker. It's a technical term for it, that runs in the background, which is caching your pages offline. So you're not downloading all of CKS onto your phone or your device, but as you look through different pages, it stores a copy of that on your device so that you can then access that if you're offline. But you'll only be looking at the pages that you've already downloaded and looked at. On your phone, it might not install in the same way, but you can add it onto your home screen for easy access. So on an Android phone, again, you open up your web browser, you go to the CKS website, and then you click on the 3 dots that's next to it. And when I did that, I got this little option at the bottom to add CKS or nice to my home screen. And on an iPhone, you go to the website, and you don't get the same options to install, but if you then click at the bottom of your screen, you get the little share button, that's this one in the middle here, and then you get the options, and you if you just scroll up the page a little bit, you get this option to add it to your home screen. And once you've done that, it then puts the little icon on your home screen for you, so then you can click into it and access that really easily. So that's the end of everything I wanted to show you. So I'll stop sharing and I'll hand back over to Emma.
So thanks for that, Fran. That was fantastic. So I just want to share with you just some personal views on how I've used the CKS and even how I've come to be interested in the CKS. So I suppose it all stemmed effectively from, we all know that we get unwarranted clinical variation in practice, in musculoskeletal practice, as with other specialities. and I'm part of the group called MSKR, or MSK Reform, and we were particularly interested in this, so we ran a survey, and one of our questions was, what was the most important factor to inform practice for musculoskeletal clinicians? And we asked them all sorts of questions, you know, what things, where did they go to inform their practice? And that could have been blogs or webinars such as this, or, you know, tutorials, you know, all sorts of things, journals, even just speaking to their colleagues. And the thing which ranked highest was guidance, and in particular, NICE guidance. So we know that NICE guidance has got some musculoskeletal guidelines, such as the back pain guidelines, the OA guidelines, and obviously more recently the pain guidelines. And obviously there's quite a lot of rheumatology guidelines too. But when we did a poll asking again another group of musculoskeletal practitioners what guidance they actually wanted, the things which were coming out really high were guidance around shoulder pain, on cervical radiculopathy, on plantar fasciitis, on tennis elbow, on Achilles tendinopathy, things like that. Now, around about this time, as a NICE fellow, because when you're a NICE fellow, you're part of a cohort of 3 years of fellows, and they come from many different walks of life, many different specialities, many different disciplines. And it just so happened at this period of time, I was a practitioner interested in musculoskeletal care, and I'm a physio, and we had Peter Dixon, who's also interested in musculoskeletal, from the Royal College of Chiropractors. We had Matthew Rogers, again interested in MSK, from the Institute of Osteopathy, and we had Johnny Rees, who's also interested in MSK, who happened to be an orthopaedic surgeon from Oxford. So this was a great opportune moment. So I started setting up some meetings and discussing with these others, my other colleagues here, my fellow fellows, about what their thoughts are. And they were agreeing. They were like, we really need to escalate this. We do need more NICE guidance, particularly around these areas. So we took our concerns to Deborah Collis, who's one of the associate directors at NICE. And Deborah sort of said, well, for all the things you've just told me about, you know, we've got CKSs for those things. And so we were aware of CKSs, but we decided to look into them a little bit more, learn about them a little bit more. And I did what probably most of you would do. I thought, well, I'm a shoulder specialist. I'm going to look at the CKSs for shoulder problems. And when I looked at them, I thought, you know what, if I'd been tasked to write these, they wouldn't look any different, or they wouldn't look much different from what they are. So that gave me a certain amount of confidence in using them. So we did another poll, and we asked again, group of musculoskeletal practitioners, if you were to, you know, have you heard of the CKSs and do you use them regularly? And out of that poll, it was of 116 people, 31% said they'd never heard of the CKSs at all. So hence why we decided to do these webinars. So just from a clinical perspective now, from a purely clinical perspective, I've recently been involved in setting up an FCP, a first contact practitioner service, in the Tamworth area. And as part of that, I myself worked for a short period of time as an FCP. So I'd gone from working as a specialist shoulder person to musculoskeletal shoulder person to suddenly become very generalist. And so working from secondary care right the way down to primary care. And that for me was just a little bit of a fish out of water moment. So when I came to doing my clinics, what I found extremely useful was having the CKSs on my phone. So that if I had something coming through, so if I'd say recognise something coming through and it was a plantar fasciitis, I haven't seen a plantar fasciitis for many years, I felt fairly confident in it, but it was really useful for me to just double check that I was still conforming to the most recent up-to-date evidence that I could. It was also quite useful, I say with some trepidation, in one patient came in, and like patients happen to do, they had come in with more than one problem. So this patient came in, I think it was for knee pain, and so we managed that. And then right at the end of the consultation, the patient said, well, actually, I've also got this little rash that's developed. It's a bit itchy, rash around the side of my chest here, you know, should I worry about that? and you're thinking, oh God, it sounds like it might be shingles. I don't know much about shingles. So I had a quick look on my CKSs, and I was able to say, well, have you got X, Y, and Z? And or she said yes. I said, well, it might be that it's shingles. I'm not going to diagnose you that because it's not my speciality, but you might benefit from having some viral medication. So with that, I booked her back in with a GP saying, is this shingles, to hopefully help direct. So it was useful for me. I was able to advise her to a certain degree, but obviously some trepidation is you need to work within your own scope of practice if you're going to do something like that. So I believe that for FCPs, this is a super valuable resource, and particularly FCPs out there who aren't using it, please do have a go looking at it and seeing whether it would be of value to you. The other people or the other practitioners who might be very useful for, like Ian's already alluded to earlier, are student musculoskeletal practitioners, like the GPs, or whoever it is, or physios, chiropractors, any students. Very valuable resource again to help get them on track, or maybe more junior members of staff. For other people coming back into the area of practice, so people have been out of practice through maternity leave or whatever, extended times out through illness, coming back in, having that as a resource could be extremely useful too. So from my point of view, I mean, that's just a few examples of what I've found and what people have told me they've found that have been particularly useful, but I'm sure there are plenty of other uses from them as well. So I think that's all I want to say. Fran, do we have any questions that have come about, or does anyone want to ask a question now?
We haven't got any in at the moment. If anybody would like to, you can either stick your hand up and unmute yourself, or you can use the chat and stick a question into the chat. We've got a few more minutes before we finish.
I will also, I think Ian mentioned it before, but they are regularly updated, and they are updated for, is it once every 5 years, did you say, Ian?
Yeah, so they're scheduled in that way. That's the sort of maximum time we let the topics go without review. Yeah. So, but there's as I mentioned, they're very often updated before that sort of that maximal 5 years. Yeah.
Okay. So we've got one question which has come in from Alison Starkey. Is there a CKS for benign hypermobility? Do you want to have a quick search for it? I don't know off the top of my head.
No, I don't.
Fran will have a quick look for you. I
am having a quick look. It doesn't look like it.
The one thing to say, with the people who developed the CKSs are Clarity Informatics, and it's Jerry Morrow who's sort of the lead for that. And when I've spoken to Jerry, he's asked, if people are very willing to be helping with the updates of these, providing that they've got the, credentials to do so, he would invite more AHPs in particular, or people to be involved in this process. So yes, please do. Similarly, if there's something where you feel there is a need for a CKS, such as the benign hypermobility, it may very well be that we want to start contacting Jerry to see whether this can be brought forward and brought out. I think we have got some new ones pending, haven't we, Ian? We've got some, but I don't think there are any MSK ones.
No, the only one that I thought in my ignorant way might be MSK related was a rehab topic, post-trauma rehab. I thought there might be some aspects of musculoskeletal in that, but I haven't looked at the scope for it in detail, so I don't know. But the other new topics we have are safeguarding, pressure ulcers, fecal. I mean, I think we've got personality disorders. So you can see there's a huge range in terms of the specialities we cover, and the kind of guidelines we're looking at converting into CKSs basically.
If I just share my screen again, I have just found, so under the developmental rheumatology in children, there's a scenario here for hypermobility in children. And then if I click on that, it then talks talked through considering referring a child with hypermobility. I don't know if that, I did that just by using the search bar at the top and searching for benign hypermobility, and that's the scenario that came up. So it's worth, even if you don't find something within the listing, it's worth using the search bar, because it might then jump you to a page that has some information on there.
That's great. Thanks for that, Fran. We've just got a few comments coming through in the chat. Just a fantastic resource. Thank you so much from Dawn. Hannah Munn was saying that she was unaware of this resource before the email invite came, and she works as an SCP, and she'll be keen to let the rest of her team and as well as the GPs know that they're around.
Question here about whether they can add links to websites on their own websites to CKS, or text from CKS mention the source, obviously. So yeah. Yes, you can add links to your websites, and yes, as long as you reference CKS appropriately, then that's fine, isn't it, Ian?
Yeah, I think it's worth pointing out that the intellectual property on these products doesn't sit with NICE, and so it sits with the provider, because we could switch provider, for example, at the next procurement, and so the content would go, we'd get new content in. It's almost like a subscription, but one that's modeled to our needs and published through our website. So you can't, for example, go and reuse the content in a CKS without getting authorization for CKS. You can look at them as an individual, you can use them in your practice, you can reference small parts as you would with any sort of academic exercise. You wouldn't grab a whole journal chapter and pass it off as your own. So if you think about it in those terms, so you can quote CKS as long as you acknowledge it in small parts. If you're doing that, I think and probably as you would if you're thinking about protocols as well, you wouldn't be taking the whole of it. You'd be taking bits of it and referencing it appropriately. So I mean, I think that's all within the rules. If you were trying to, especially if you were trying to sort of reuse content for, I don't know, your own commercial education company, or build a whole new website using CKS, that would be a no-no, I'm afraid. But yeah, hopefully the deep linking is perfect. So there's lots of sections within NICE. If you rather than go through the structure that Fran has talked, and if you want to take people to a deep part of the page, link as deep as you like, and as usefully as you like, and yeah, so that would be very helpful for us to refer people into the site. Thank you.
Great, thanks, Ian. And then we just got some more comments from people saying it's useful to use with patients within consultations and stuff. So
yeah, and one thing I would say is they're not written for patients, they're more written for clinicians, but obviously they are accessible to patients. But what would be quite nice in some of the discussions that I've been having more recently is how nice would it be if we could give a bit of a lay summary for patients to be able to use, so that patients can help direct their own care in the future. So that may be the direction we want to go in. So I think that's all for the questions. There's lots of very positive comments on there, so thank you very much for those. I think the main thing is now to say, please, please, please do have a go at using them, not next week, but ideally this week, ideally today, because it's like with all these things, unless you use them straight away, and it starts to become embedded in your practice, you'll forget all about it again. So yeah, please do have a go at using them. If you have any concerns or any queries, Fran's already put her email up in the chat there, and Fran's already said she doesn't mind being contacted with things like this.
You should also have my email on the invitation email that you've had with your link in. It's got my details if there are any problems, so you should be able to pick that up as well.
And I suppose the final words are, please do spread the word, because the more people we have working to good level evidence, the better, and we will see a reduction in this unwarranted, unwanted clinical variation in practice. So just to finalise, just to wrap up then, this will be available. One of these recordings will be available soon, and at the same time, Fran said she will send out the slides, so if you're having difficulty popping it on your phone or whatever, I've got it on my phone. I find it really very useful indeed, but you can put it on your laptop or your whatever either. else. But yes, all that information will come through to you in due course. Okay, so thanks everyone, and enjoy using the CKSs.
Thank you.